Examining the problem of nurse understaffing and its solution. Problem. The problem of understaffing in nursing has been associated with a variety of factors ranging from extended work shifts to poor work conditions. Such pressures as extended work shifts can increase nurses' burnout and contribute to low-quality patient care. With exhaustion come shortages in nursing personnel, and as a result of shortages, healthcare facilities could experience understaffed shifts. Thus, there is a need to focus on the issue of understaffing to ensure that the quality of provided to patients' care maintains the highest level possible while that nursing professionals in a healthcare setting remain satisfied with their jobs. Context. The problem of understaffing of nurse professionals occurs within the context of a healthcare facility. In such facilities, nurses are subjected to extremely intense workloads that have a direct influence on their performance, patient satisfaction, as well as the satisfaction of nurses with the level of overall clinical setting. Nurses' working conditions during shifts usually determine whether the skills of medical professionals would support their performance. Therefore, if a healthcare facility lacks necessary resources and does not take patient safety into account, there is a risk of nurse understaffing due to the inconsistencies between what nurses need in their practice and what resources they actually receive. Description. Registered nurses are the largest group of professionals working in the sphere of healthcare. The shortages in nursing personnel suggest that fewer individuals enter the field. Furthermore, it is becoming much more complicated to predict such shortages. However, some predictions can still be made. It is expected that by the year 2020, the shortage in the number of available nursing professionals will go hand in hand with the increase in the demand for their services because the generation of baby boomers will age. This means that the issue of understaffing in nursing is not only associated with the workload or the availability of supporting tools that help nurses fulfill their responsibilities but also with the peculiarities of the society that align with specific healthcare needs. Therefore, nursing understaffing is a multifaceted problem that requires addressing from a range of perspectives such as the overall well-being of a society at a particular point in time or the quality of education that prepares future professionals for the role of nurses operating in healthcare settings. Impact. Researchers investigated the impact of nurse understaffing in a variety of contexts ranging from patient mortality to nurse burnout. For instance, research by Aiken et al. Found anecdotal evidence that was linking inadequate nurse staffing or lack thereof with patient deaths. It was also found that a high nurse-to-patient ratio had an impact on the health outcomes of surgical patients as well as the failure-to-rescue rates. Furthermore, nurses were much more likely to be dissatisfied with their jobs and experience burnout when there were inconsistencies in staffing. It is also important to mention that understaffing in nursing can be linked to risk-adjusted mortality in neonatal care, as found by Hamilton et al. The exposure of premature infants to the inadequate level of nursing staffing can potentially result in risk-adjusted mortality, which presents a tremendous challenge for the sphere of healthcare. Significance. Resolving the problem of nurse understaffing is significant since it would potentially enhance the level of provided care and ensure that nurses are satisfied with their jobs. Because it was found that for each nurse-sensitive outcome, there was an increase in prevalence for those who were exposed to understaffed shifts. Preventing understaffing is imperative for improving patients' quality of care. As nurse understaffing has been linked to poor patient outcomes, contemplating its significance is unnecessary. In order to ensure a high quality of care, nurse educators and administrators should unite forces to resolve the problem. Solution. While solutions for preventing or minimizing nurse understaffing are vast, one of the initial steps towards solving the issue is associated with the promotion of positive work relationships among the nursing staff in order to enhance the work environment. Because nurses can leave the profession because of poor nurse relationships that create a negative work environment, understaffing can occur in cases when such an environment is not improved. Adequate preparation of nurses to become professionals in their field can also contribute to the solution of the problem along with the provision of necessary resources that support nurses' operations within a healthcare setting. Since understaffing can be linked to nurses' dissatisfaction with their jobs, it is crucial to take into consideration all factors that could add to their satisfaction: positive nursing relationships, adequate education, balanced work schedules, supporting tools and resources, as well as high compensation for their services.